Okay, as we're starting the session today, I just want to have the panelists in the room quickly introduce themselves, and we're going to go over some of the options for you to ask us questions. Dr. Reed?
Hi, sorry. Hi, everybody. Welcome. It's Red Friday. So we got red in the room. So welcome. We wanted to set up this session because we know we had a number of our international students with questions. And so we did a session late yesterday that we had a full house with 100 folks. Today, we have a session that has unlimited. So we're going to start. We do have a series of questions that had already come in from communication that went out to all of you the last couple of days. So why don't we jump in, because we're going to be here all till about 5 of 11. So we've got about a half hour together with everybody. So do you want to start with academic questions?
Sure. Yeah, sure. So there were a lot of questions about classes and formats. So I'm going to run down quickly some of the questions that came up, provide some responses. So one of the questions was whether it's possible that in-person classes are going to resume before the end of the semester. So what I can say about this is, as everyone should know at this point, beginning March 23rd, we are moving to remote instruction. The expectation is that classes will be held through the end of the semester to ensure academic continuity, and that all classes will meet remotely except for experiential learning that may continue as it currently exists for some students, for example, in the health sciences related to clerkships and placements, and in some other special circumstances. The expectation is also that all classes will be offered at their regularly scheduled times. Another question came up related to midterms and finals. Again, the expectation is that all midterms and finals will take place remotely. And that students will participate in course instruction, finals, midterms remotely as well. As far as labs are concerned, I know that's a big concern for students. Instructors are working to transition labs at this point to an online format. For right now, students should expect to participate online at your regular time that your labs are held, but this plan may be subject to change, and instructors will notify students if alternate arrangements are being required. So they are in the planning process related to labs, but you should continue to move forward with the expectation of those meeting times and in communication with the faculty for those labs. In terms of, there had been a question about graduation and commencement. So I think people know at this point that all in-person student campus events are canceled through March 31st. But no decisions have been made about university events after that date. Later yesterday, a question had come up about office hours, although it wasn't one of the questions that was submitted. So just to provide information about that, faculty are being asked to provide office hours, both in sort of limited in-person, so individual in-person format, or remote format, to again try to maintain academic continuity and academic support for students taking their classes.
Great. Thank you for that. To follow up to related to commencement, right now, since as Dr. Germana mentioned, nothing is changed after April 1st at this point, only events through March 31st. The two things about commencement is that if you are graduating this May or August, there will be opportunities to still do one-on-one photos with a vendor. You'll get that information from conference and special events that runs commencement, and they'll also be doing still cap and gown orders. So that is still taking place now. A decision around commencement we anticipate would be made around mid-April is the latest that we have. I know lots of questions about immigration status and folks leaving the country. Let me just make one statement, then I'll turn it over to Lindsi Walker. We are, and as things have even evolved in the last 24 hours, it's really important. We are recommending that international students that you do not travel at this point outside of the United States. As you know, President Trump had put in a directive that no flights from Europe other than the UK would be coming over for the next 30 days. All their international travel is being halted. Domestic travel is not currently impacted, but we don't know. This is an evolving situation. And just to point out, just kind of a landscape for all this. One thing we need you all to know and realize is that in the United States, there's been very little testing done compared to China and others, which is why in those areas the numbers of coronavirus confirmations is very high. Here in the United States, that testing has just begun, and it will still be rolling out actually more nationally in the next few weeks. So we anticipate the number of cases will grow, and as the number of cases grow, that will then result in more either, quarantine areas or other places to limit travel. So again, this is just a word of caution. We're trying to keep you safe, as and that includes staying on our campus and being in your home here and doing all the precautions and protocols that we've shared. That includes washing your hands for 20 seconds, making sure that all your surfaces in your room, as other people touch them, whether it's a computer or a phone, that you're constantly wiping those down. Also making sure you're staying 6 feet apart from others, making sure that you're not shaking hands with individuals, that you're not hugging other people. So I know it sounds odd because as human creatures, we all like to be near each other, but the goal of this is to make sure we're limiting what we're calling social distancing. So we just ask that you help model that same behavior for each other within your work here, which is, again, one of the primary motivations for the university moving to distance learning is to, one, reduce the number of students on our campus, and two, to make sure that we actually, those that remain on campus, can spread out as much as possible to limit human contact. That's really the goal. A huge part of what we're doing here, we're viewing as precautionary. We're trying to limit the spread, so we're doing everything as a precaution rather than do something after the fact. We'd rather do something early, and that's why the Stony Brook, as well as the whole SUNY CUNY system and really nationwide, have taken these pretty dramatic steps to try to limit the spread of this illness. So why don't we talk about some of the visa questions that came up?
Yeah, so a lot of you guys have some really good relevant questions concerning your immigration status, and that is what we are here to help you with. My name is Lindsi Walker. I'm the Senior Assistant Dean for Global Affairs, and one of the units that I work with is Visa and Immigration Services. And we are still here, and our staff are here to help and support you, and we will continue to do so. Some of that may be in alternative formats as well, including Zoom or Skype sessions or whatever we can do, but we are still available to help and support you. A lot of the questions that we're getting from students are related to, do I have to stay? Can I leave? What are those requirements? So I think it's really important for you to know that you are not required to stay at Stony Brook University. You need to assess a few really important things to make a decision that's best and right for you. The first would be, can you complete your courses if in fact your faculty do adhere to them being held on the same date and time as they were here on campus? That, as well as the technology that you would need to complete those courses. So assess that and make sure that wherever you are abroad, you could fulfill that requirement as expected by your faculty. And then the second layer of that would be, if you are a degree-seeking student and you intend or hope to continue your studies at Stony Brook either in the summer or the fall, there is certainly a risk related to re-entry to the United States. So I think that you need to assess that and really understand those risks. A question that a lot of you all have had is related to this 5-month absence from the United States, and is it necessary for Visa and Immigration Services to end your F1 record based on your departure? So it's really important that you understand that we as an institution are required to comply with federal regulation. One of those regulations, which you can access through the Department of Homeland Security Study in the States website, which is the student website for international students here in the United States, where it clarifies this, and we're going to have this linked for you in the FAQs, that if a student is outside of the United States for more than 5 months and it's not authorized through study abroad, that you require updated immigration documents to re-enter the U.S. So as that stands now, what that means for you is, if you tell us now that you are departing and not returning until the fall semester, that exceeds 5 months. Therefore, we as an institution are required to report that to the Student and Exchange Visitor Information System. So we are required to report that. And if you say, I'm coming back in June, and it's less than 5 months, then many of you have asked, what are you going to do? We will not then end your F1 record terminated for authorized early withdrawal. We will not do that because you have the intention to return within that 5 months. However, it's very important that you understand you are responsible for maintaining your immigration status. And if you are not able to re-enter the U.S. within 5 months, you are required to follow the procedures that were sent to you through email of submitting the form and access vis of ending your F1 status. And at that point, we'll walk you through what are those next steps, which in fact could include a new I-20, a new CVIS ID number, and a new visa. And I know that that is concerning for a lot of you, but that is just the reality that if you're outside of the United States for more than 5 months, as it stands now, there has been no updated guidance provided by SAVP to offer any type of accommodation for that. I know some of you have heard of other schools giving different guidance. All we can tell you from Stony Brook is we're adhering to the guidance provided by SAVP. And you could, if students try to re-enter when they've been gone more than 5 months, you have to understand that that is a risk, and Customs and Border Protection reserves the right to not allow re-entry to the United States. Some of you guys have had questions about CPT and OPT, those workshop sessions. We're going to be sharing with you the information through email, but then also soon, within the next week or two, we'll be setting up formats for you to participate in those similar to this through Zoom sessions. Someone even already asked a question about CPT for the summer. I think that we'll have to determine with your faculty and your department, where is your CPT location. As it stands now, my understanding, and Dr. Germana could speak to this, but I think internships are, I guess, on a case-by-case basis, or maybe they're being.
Yeah, so there's some individual messaging that's actually going out related to internships and the different kinds of internships that there are. And that messaging is going out both to faculty, and there is a message that went out to students and another message that is going out. So some of that is going to depend on the nature of the internships. And faculty will be working with students and their site supervisors or agency supervisors around the continuation of those internships. And so for some of them, there will be exceptions that will be made to allow them to continue in person. And then for others, there will be remote opportunities that will be provided.
You want to talk about the question? There's a question about, will Stony Brook cancel the summer session?
It is not my understanding at this point that there will be an impact to the summer session schedule. So we are continuing to move ahead with the advanced registration period, which will begin around April 6th. So it's scheduled for April 6th. It will, at this point, continue for April 6th for fall registration, and also for the summer session registration, which begins for all students on April 7th.
Unfortunately, in the summer, there are already a number of online classes, so summer session will continue as usual. It is a possibility that what's listed as a face-to-face class, depending upon the situation, could potentially move to remote learning as well, but that will be determined again. It's really based upon the conditions in our county, in the state, in terms of what seems to be the safest protocol. There's a question, are there any cases found on our campus? Just to explain, some people have made comments about there being cases on our campus. We are the West Campus on this side, then we have Nichols Road, and then we have what's called East Campus, and then Stony Brook Hospital. Stony Brook Hospital, as an entity, does treat people with any illness. There have been a few confirmed cases of coronavirus that you've probably seen in the media that the hospital is treating. They have a fully trained medical staff that's actually managing all of it. They've obviously been preparing for this. They will also be introducing testing in the next at least few weeks. I don't have an exact time frame on that. So that will be something that will be part of the hospital operation. On West Campus and East Campus for students parts, there have been no cases at all. That may change. We just don't know at this point, but that's why we're putting these precautionary measures in. That's why also, if you're a resident student, you've heard that we've now limited non-resident students from entering buildings or having overnight guests. That is really to protect you and the community if you're living on campus. There was also another question about if students leave after spring break, would we rearrange students? The plan right now, again, in fact, if some students choose to leave, that will actually create more room in the residence halls that will allow fewer people in the space, which is actually one of our goals. So no, the current plan is that we are not changing anything in terms of rooms at this point. But if, because again, we're actually we don't want to create density. We're trying to spread people out, so there'd be a reason to keep every residence hall open and operational, in fact. At the end of the academic year, based on people leaving, we obviously may identify what would we view as better summer housing spaces than others, but that's to be determined. And I do want to point out that while we know this is live now and it's being recorded, this is as of Friday, March 13th at 10:40 a.m.
Right.
We know, like Dr. Germana mentioned about the online class, that we know that's set. This stuff, we know it's set pending any changes that the government might introduce. So I just want to be clear, what you're hearing now is accurate as of that. Certain things that we know are not changing, other things that we're saying could change. We just want you to be aware of that, as that's where we are as of this date and time.
You guys also, there were a lot of questions about domestic travel, and I think we just, I mean, if you want to answer that.
Yeah, so as I said before, as more testing is done, that's going to result in more cases. And what I want to make it clear, in fact, I know that might raise level of anxiety when you hear this growing number of cases. In fact, what I want you all to think through psychologically is that knowing the cases there allows better treatment to then isolate individuals rather than not knowing. So what's going to happen, and this is, again, I'm not a doctor, but in terms of the predictions that have happened, you will, at some point with this, would hit a peak, and then it would actually level off based upon that you've actually done everything within your health system in terms of trying to do the precautionary measure of separating people. So to Lindsay's point, and the question people asked about domestic travel, we already warned you against international travel for very obvious reasons. You may not be able to get back in the country. That's the important thing. Domestically, I would still say that caution as well, because here's the thing, the more people you interact with off this campus, the more chance there is of transmission. And so we're just trying to be cautious. So I would argue if there's travel you don't need to do at this point, don't do it. Just stay on this campus. That's really the best advice I can give. There are, as you see, if you look at the US map, there are a few pockets here and there where, New York City is one area, California, Seattle, Washington, there are some pockets. Others will emerge, I think, in the next few weeks as more testing is done. So again, for spring break, if you can stick around and stay here, it would be best, is my advice. But again, you have to make the decision that you think is right for you. Yeah, with camp, let me just see if there's other. Yeah, so if a student did test positive, again, we do have the hospital, so we do have mechanisms to treat that student, as well as other locations where that we can isolate students for their care. So we have that work done as well. Insurance, by the way, I don't know if you want to talk about the insurance coverage through the International Student Health Insurance.
Yeah, so you guys, as you should hopefully know and have access to, you are all enrolled in the International Student Health Insurance. And that's excellent coverage. You can go, if you go through we might put the link for you up there, but the Stony Brook website, and if you just type International Student Health Insurance, it comes up. The great news is the testing for coronavirus is covered in your plan. You also have an unlimited, there is no cap on your coverage for your health insurance, both for hospital or with your physicians. You can look at the details of that through the website at stonybrook.edu, but certainly your health insurance is really great insurance, and should take care of the needs that may arise, which we hope are none.
So should we just mention too, just anything else with residents on Catherine Mary? You think that folks were asking before?
Hi, just to let everybody know that we are still fully staffed. There are professional staff and resident assistants still living in all of the halls that are there to assist you and offer you support, get you connected to resources if needed, if anything's happening in the community that you're uncomfortable with, or if you have any questions, they're all here for you. Our services are still fully open. I know some folks had asked, if you do decide to leave for a period of time, should you take all of your personal belongings? That really is a personal choice. Obviously, if you check out and leave campus, which we don't suggest, especially for international students, you would have to take all of your belongings. And we have external companies and vendors, FedEx, we're working with for storage options. However, if you do decide to leave the country and you don't take all your belongings, you just need to know that you would still be responsible come checkout date, May 20th. At the end of your contract period, your belongings would need to go. Otherwise, you could be held responsible fiscally for the storage of those items. Other than that, the summer, I think Rick said, we plan on being open. You will have a place to stay if, whether the classes are online or not. And that is going to go live in mid-April. So look in our housing portal for that. And dining options are still open. They're making changes depending on how many students are here on campus. It might be limiting some of the options or stations, but they're taking a lot of precautions in terms of hygiene and cleanliness to make sure that all of the serving of food is safe.
Right. So they eliminate self-serve items in the dining facility.
Yeah. And, you know, a lot of questions around safety around COVID in the halls, given that we have density, and we will continue to push out information around hygiene, keeping your space clean, keeping yourself healthy. If you're not feeling well or your roommates are not feeling well, please encourage to go to the health center to get checked. You know, some people ask if they did leave the country to a place of, is one of the countries that you are not allowed to travel back from, would you be able to come back into the residence halls of your roommate? No, you would not. That 14-day quarantine, you would not be able to come back to the halls until after that time if you chose to leave the country.
There's some questions about travel signatures. So Visa and Immigration Services is still providing travel signatures. So just to make sure we're clear, you do not have to have a travel signature to leave the United States. You have to have the travel signature to re-enter the United States. So if for some reason you have an emergency and you have to leave and you don't have that, there is nothing preventing you from leaving. That would just have to be mailed to you. But we are still providing services, including, I think, yesterday or the day before, we had a travel signature day. So we are still providing those for you, and we're continuing to provide services. We're just wanting to make sure that you are advised and aware of the potential risks of re-entry at a later date, but certainly we are not preventing anyone from, you know, leaving or returning home if that's the decision that's best for you and your family.
There are a couple of questions. So one is there probably kind of, if I get tested positive, I do not live on campus. Just so you understand the procedure. If you are, right now, we don't have the ability to do testing at the Stony Brook Hospital. That will be coming soon. They have a relationship that we can send stuff out to then be verified or checked. Just color, I do want to say at the outset, just because your roommate sneezes does not mean they have coronavirus. And I think it's really important. We are still in what we call influenza flu season. And so people are, you know, and some of the symptoms are the same. So whether it's upper respiratory situation, you know, breathing challenges, a cough, a persistent cough, a temperature, a fever, those are parts that, again, if any student, regardless if this was going on currently, our advice would be, whether you're on or off campus, if you're a student at Stony Brook, go to the student health services. That's the most important thing that I want to stress. They will then make a determination of what steps are necessary. All cases we've had so far, students coming in, they've all been diagnosed with the flu. We have the test for the flu, so we can know that. If they're not sure or can't determine it, then we would work with Stony Brook Hospital and a local health department to determine if, based upon the information the student or could be an employee, staff member shares, if they are a candidate to be tested, then they will work through that process. If somebody was identified as positive, the hospital, we would work with them to identify the appropriate protocol. There have been some cases where the hospital has taken that in as a patient. There are other cases where someone's been quarantined at home. Obviously, in those cases, we would not have somebody back in our residence hall living with other residents. We have already worked at a plan to address that. So again, we are doing everything we can to keep everyone you know, safe and healthy on the campus. I think there was one other. Oh,
Travel signature available. So we don't have a travel signature day today. We have appointments, which I think are all booked. But certainly you can call Visa and Immigration Services and make an appointment or find out the next opportunity. You can always also submit the form online, and depending on, you know, you can, if you're away from campus already, that can be mailed to you. But certainly call and you can make an appointment, and we can arrange to make sure you have a travel signature. You also are required to fill out the form and access this.
So I just want to point, there's a question again. We need to lower the anxiety level here a bit, just so you know. And again, I think it's helpful if you look at actually the CDC, it's called the Centers for Disease Control website, that looks about what are protocols that you can put in place in your own lives to be preventative, and that what happens if somebody is diagnosed with coronavirus or COVID-19, and what the recovery is. What all indications have indicated, and fortunately we're in a community at Stony Brook with a lot of mostly young students, and in all the cases that we've seen, individuals who were young and healthy recover just like they would from the flu. The real issue here at hand are individuals of advanced age or those with underlying health conditions that are more concerning in this situation. So again, I'm not a doctor. Please don't, say I said all this. I'm not making I'm not the medical doctor to make the statements, but I just say everything we've read about on the CDC website talks through this situation, and we just want to make sure that you are getting the facts and not letting rumors or other things, help drive this narrative. So just make sure you're looking at the facts.
Just before we get off, if they have existing concerns about their immigration status, we encourage you to watch this from the beginning, because we address some of those concerns if you tuned in later. Certainly utilize the FAQs. Visa and Immigration Services will also have some customized FAQs available to you by the end of today that will be linked out from the main page. We'll probably also send you an email about those. So we encourage you to utilize that. We think we've answered most of the questions.
I do. As one other question came in, I think this is really important. I'm going to turn to Dean Chambers from heads our Multicultural Affairs area. We have gotten some concerns from students related to xenophobia and feeling that they've been targeted based upon their origin, and so we just wanted to turn to her to kind of address a bit about, as a campus, how we're responding to that.
Yes, and certainly all members of the university community, students, faculty, and staff, we're all in this together. And so it's really important that we support each other, and during this time, specifically though, and if there are any occasions where anyone who's within our campus community feels that they're either being discriminated against, or that they are experiencing microaggressions, or whatever slights that there may be that others are expressing within our community, that we encourage you to report those situations so that they can be addressed. Our Office of Institutional Diversity and Equity encourages campus community members to report things so that they can look into them, and also so they can properly be addressed, because discrimination is not tolerated on this campus, and situations and incidents about that are taken very seriously. And we need to know these things so that they can be properly reported and addressed. The Office of Institutional Diversity and Equity is located in room 201 in the administration building. You can also call them. I would encourage you to visit their website, as well. If you go to the university homepage, you can put in OIDE, and it'll take you directly there. They have a system that is called Report It, and you can report online from their website, as well as call them. And the number is 631-632-6280, if that is something that one can elect to do. But certainly, reaching out to them as an initial step to have issues addressed and also heard and learned about is important.
Great, thank you. Thanks. I know we've got about 3 more minutes. If there are any other questions folks want to type in, is there anything anybody wants to share that we didn't cover? We've got covered a lot of ground.
We encourage you to share this with your friends. We think that a lot of the questions we've been getting are you're asking similar questions, and they're all very relevant. So certainly, share this so that we can utilize this forum to try to answer questions, because we want to help you as much as we can, but we have limited staff and a lot of students.
And that's why we want to do the session, so the facts kind of get out to everybody. I know we're recording the session, so what we're going to put a link up.
Absolutely.
Folks. So if you could share with folks that said, oh, I missed this, and how'd you get the information, we'll share the link So I'm just going to ask a couple final things before we go. One is that the university's main website is stonybrook.edu/coronavirus. And there's information that's posted and updated there daily, as well as a series of frequently asked questions or FAQs. I would ask, as Linda was mentioning, we have limited staff to manage everything. So we want to make sure you're checking for the answers to the questions there first, also listening to this, and then only going to offices or making calls on questions that have not been answered, or there's something very specific to your case that needs to be addressed. But as we've said, a lot of these, we're giving you as much information as we can for you to make the most informed decisions for yourself. So again, as you watch the media too, we recommend you keep watching for updates, because there may be additional travel interruptions that will occur, whether it's even local travel or nationally, internationally. So please keep watching the news, because that'll be another good source of information for you. Okay. All right.
Thank you.
Thank you so much, everybody. Have a good spring break.